Do you know who is going to care for you when you are old and frail? By current standards, it's likely to be a middle-aged immigrant woman, with maybe a high school education and little if any training, making $20,000 a year. And that's if you are lucky. If you live in rural America, you may already have a hard time finding somebody to look after you. Paul Osterman of the Massachusetts Institute of Technology's Sloan School of Management calculates that if nothing is done to draw more workers into the field, there will be a shortage of at least 350,000 paid care providers by 2040. This, I'm sure you'll agree, makes little sense. How to provide long-term care for a fast-aging population poses one of the more convoluted challenges of the American labor market. Care providers, home health aides, personal care attendants and certified nursing assistants, in the government's classification, are expected to be among the nation's fastest-growing occupations. The Department of Labor's economists expect about 1 million more will be added from 2014 to 2024. And yet, despite their critical importance to the well-being of tens of millions of aging Americans, 1/4 of these aides live in poverty. The jobs are so unappealing that it is hard to keep workers in them. 4 in 10 leave the occupation entirely within a year. Many prefer the fast food business. Home care is absolutely the bottom rung on the ladder, but home care workers are the people that spend the most time with the client, said Adria Powell, who runs Cooperative Home Care Associates, a worker-owned long-term care agency in New York. As President Trump promises to recover the jobs of an ancestral age populated by well-paid coal miners, steel workers and assemblers of air conditioners, he is missing one of the most critical challenges of the American workforce, transforming long-term care into a higher quality, better paid job that could support the middle class of the future. It can be done. In his new book, Who Will Care for Us? To be published next month by the Russell Sage Foundation, Professor Osterman suggests that improving these jobs could actually improve the quality and efficiency of the entire healthcare system. It could save the system money, he told me. There are a few reasons long-term care is such a bad job. Most people see it as glorified babysitting, said Robert Espinoza, Vice President for Policy at PHI, an advocacy group for personal care workers that also develops advanced training curriculums to improve the quality of the workforce. The fact that most workers are immigrant women does not help the occupation's status. Occupational rules that reserve even simple tasks for nurses, like delivering an insulin shot or even putting drops into a patient's eye, also act as a barrier against providing care workers with better training. But perhaps the most important barrier is the government's budget. Medicaid, funded by federal and state governments, picks up more than half the tab for the $300 billion or so spent every year on long-term care. States spend about $200 billion of their own funds on Medicaid. It is the second biggest item on their budget, after education. To raise reimbursement rates for long-term care agencies, they would have to find the money elsewhere. Still, Professor Osterman points out that short-changing long-term care is short-sighted. Home health aides trained to do more, to spot patients' health problems, to keep track of their pills and doctor's appointments and to offer advice on healthy living, could bring billions of dollars in savings from the healthcare system. Better trained aides could help patients manage chronic conditions like obesity and diabetes. They could also help manage the transition out of the hospital, ensuring that patients took their medication and followed up with the doctor, to prevent them from having a relapse or ending up in a nursing home. One assessment of the academic literature concluded that there are $250 billion in savings to be had from better managing chronic conditions and reducing hospital and emergency room admissions and readmissions. And there are other jobs for personal care aides to do. For instance, community health workers doing home visits can help bridge the gap between patients and doctors, improving rates of immunization, helping manage conditions like high blood pressure and otherwise encouraging healthy behaviors. Marisol Rivera offers a glimpse at how this could be done. After 16 years as an aide for Cooperative Home Care Associates, she was promoted to senior aide, assisting less experienced aides in the field. She reminds them how to use the Hoyer lift to get patients out of bed and into their wheelchair. She keeps tabs on hospital discharge papers to make sure patients, which the firm calls members, make their next doctor's appointment. Most of time the reason members go back to hospital is because they don't check back with the doctor, Ms. River.